Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back. And if you're joining us now, we're just getting started with our first conversation. We are joined by representatives from the Karl Heusner Memorial Hospital, and we are talking this morning all about their 25th anniversary. And joining us for this discussion, we have with us Michelle Hoare, who is the Chief Executive Officer of the KHMH. We have Dr. Beatrice Thompson, who is Director of Medical Services at the KHMH, and we also have Charlene Banks, who is the Director of Nursing Services at the KHMH. Ladies, good morning.
Good morning.
Thank you so much for joining us.
Thank you for having us.
And first of all, let me say congratulations. The hospital is celebrating its 25th anniversary. So we can start at the beginning. Let's talk at the beginning of the journey and to where we are today. Perhaps we can talk about, Michelle, we can get this discussion started talking a little bit about that 25-year journey and what celebrating this anniversary means to you.
All right, thank you. Well, our journey started actually with the move from the old Belize City Hospital to the new Belize City Hospital in 1995. Mm-hmm. And later, we were able to change our name from the new Belize City Hospital when we became an authority. And in 2001, the authority came into effect with the establishment of the KHMH Act. And of course, this was part of the health sector reform project that started in the late 90s. And so, having gone through a series of what should we call the hospital now that we are an authority, we had a name competition, and eventually we ended up with the name Karl Heusner Memorial Hospital after one of our Belizean doctors who served us for many years, Dr. Karl Heusner. So that's where we are in terms of our progression. We came from the old Belize City Hospital. I think a lot of our older citizens in Belize will remember the old Belize City Hospital on Eve Street. We moved over here, and we are now Karl Heusner Memorial Hospital Authority. We started off as a pilot project, actually, the authority, and progressed to where we are. We separated as a test for efficiency in management and autonomy from the public system, and we became leaders under the board of directors for KHMH.
Okay.
So what are you all doing to mark this 25th anniversary? I mean, what celebration, given, of course, social distancing and the limited events we can have?
Well, the fact that we are under this COVID pandemic and we are not able to do our usual ceremonies and celebrations in our main lobby, we have decided that we will still celebrate this very momentous occasion, 25 years of service to our Belizean people. We have prepared a week of activities where we do a lot of virtual activities. We do prayers in the morning, and we will be doing today, actually, for the birthday, we will actually be giving out gifts to our staff, those staff who have served us 25 years and more. And we will also be giving back to the community by offering a day of free service to our patients, our clients, those who have made today a reality for us. So some of those activities are what we have lined up for today.
I see that we're showing on the screen a couple pictures of the old Belize City Hospital. I don't know how many of you on that panel had already been working in the profession during that time or recall any experience there, or did you, Michelle, were you already a nurse? Because I knew you started off as a nurse.
Yes, I was. I remember also well this picture. And actually, I'm actually looking at female medical ward. And
yes.
old casualty department.
Yes.
Yes, so yes, I remember this picture also well.
Well,
So we were all a part of the old Belize City Hospital.
you all were, okay. Well, you said that today you're giving out gifts to your staff and you're doing a free service for customers. Like, what do you mean a free service? Because we always thought that KHMH was free.
Yes, I know the Belizean people is still under the impression, but we were never a free service. Even when we were at the old Belize City Hospital, there still was a hospital charge.
Okay.
So for today, what we're doing, we're actually giving, for the first delivery for today, that service will be free of charge.
Wow.
Wow.
We
Good.
will be giving the first 5 CAT scan free of cost today.
That's good.
For specialist clinic consultations, this is the outpatient ambulatory specialist clinic. Those persons who have appointment today will not be required to pay their $25.
Okay. Wow.
Good. Interestingly, it was $25 they were going to pay on the 25th anniversary.
And
any emergency surgery, anybody that ends up with an emergency surgery will get that surgery free of cost.
wow.
Pharmaceuticals for outpatients will also be free of cost.
Today's a good day to be sick, Gavin.
right?
You get everything free. No, but it's good to know. It's good to know you all are doing that.
Yeah, absolutely. And you know that introduces a sort of a wider topic, just to get our viewers a bit more familiar with the hospital and the services that are offered there.
Yeah.
So perhaps Dr. Thompson, you can talk to us a bit about the facilities and the range of services that is that is now offered after 25 years at KHMH.
Yes, of course. I think just yesterday we were reminiscing how far we've come with services. And I know from old Belize City Hospital, we used to offer surgery, orthopedics. The same general surgeon used to do the orthopedic surgery. And we had X-ray, the X-ray department, and the internist for the medical wards, both female and male wards, and we have the pediatricians also, and the gynae ops. And I think we did have ophthalmology there also too. So, and in terms of anesthesia, it was mostly the nurses that provided anesthesia. Once in a while, I think we had the foreign doctors would come in as anesthesiologists. And then after that, Dr. Yolanda Diaz did come as the, I think she was one of the first Belizean anesthesiologists that came on. And so seeing Karl Heusner now, we have a great staff here. We have, I think, almost 40 specialists and 90 medical officers. And so you can imagine the amount of work these people do for the public. You know. But we have done expanded emergency services. We have neurology added onto our service here, neurosurgery, we have oncology, and
Cardiology too, right?
cardiology. We also have physiotherapy, which I think was given over at the old Belize City Hospital. But all these services have been added on, and then the new one is the COVID. But also we did come along with intensive care and the neonatal intensive care and the pediatric intensive care units, and we added on dialysis for our patients and oncology also, and cardiothoracic surgery.
So
And these are very great services for the public here. You don't have to go all the way over now to Mexico or to Guatemala or even the US to get some of these services as before now.
So I just have a question to understand. And all those services, specialist services, are being given by doctors that work strictly at KHMH, or are doctors that in both private sector and public sector? And I ask that because of the SOE that we had that did not allow doctors to practice in both public and private. How does that operate, Dr. Thompson?
Um, I think our doctors are very conscientious when it came to that. You know, they were before the COVID. Nowadays we have to talk before COVID and after COVID.
Yes.
But before the COVID, we know that our doctors were given the privilege by the government to work both in the private sector and the public sector. And one of those things that is controversial, but I think from way back in at the Belize City Hospital was that because the the salary for the doctor, the Ministry of Health always considered that they were underpaid, and so they gave them that privilege to practice in the private sector so that they could make up their emoluments. You know? And that was why they had that. But during the COVID time, I know most of our doctors stayed put, either stayed right here at Karl and did very minimal work at the private sector.
Okay. That's good to know because, I mean, we know specialist service is not easy and it's not free, and KHMH does offer a better price than if you would go strictly private. And I think you all have one of the best equipped operating theater, right? And the only ICU, the only really equipped for emergency. Am I right in saying that?
Yes, we are.
That's right. That is so right. Right now, up until right now, we have 5 operating theaters. They were all upgraded, and we have the best anesthesia machines. I think the most modern ones for the country. And our anesthesiologists, they're very highly trained. So when you want very good service, you should come to Karl.
Yeah, and of course, you know, as you introduced the topic earlier, you also are really the National Center for dealing with the emergency cases
Yes,
of
of
COVID-19. Both those patients who need to be intubated and also the others who require critical care. So perhaps you can talk a little bit about how the hospital has prepared for the pandemic, how it's dealt with it so far, and you know what the experience has been like for you all.
Yes, and I would especially like to hear from Charlene Banks.
Yep.
She's involved in nursing,
Yes.
and we know the nurses are around the clock available, and the doctors, they do their intermittent visits. So, Charlene, how has it been from the nursing services perspective? And, you know, sometimes we tend to not mention the nurses, but they're the soldiers always on the ground.
Yep.
So, can you fill us in?
Okay, so let me first explain and say to the public that in responding to the COVID pandemic, KHMH literally had to put in place an additional critical care isolation unit,
Yes.
specifically for COVID patients. So that was an expansion in itself for the services that we provide. Because our adult intensive care, pediatric and neonatal intensive care units continue to provide service for non-COVID patients. And so we prepared by organizing an area dedicated for COVID management. So that in itself is an expansion. We can say we are proud to deliver today to the Belizean people. Of course, we had to equip the area and we had to staff that area, build capacity, particularly in our human resource, to be able to respond to the cases, this new virus that has been attacking the world, basically, right? And so there was a lot of work that had to be done, and I must say that our staff rose to the challenge, and they participated, they responded, and honestly, it's a joy to see how they want to work with the COVID patients in the COVID unit. So, I believe that we really have to say thumbs up, big up to our KHMH staff, those who actually work the unit, and those who are in the background supporting those who are actually working with the COVID patients.
Yes.
No.
So,
And yeah, Charlene, your perspective as a nurse and as the director of the services, you can also talk a little bit about how how the operations, how nurses then, I should say, had to deal with the pandemic as well?
Okay. The nurses at KHMH, I must say, have been very dedicated and supportive over especially this COVID pandemic. We had to use staff that we already had. We had to find a way to educate the staff over the time. We had to find a way to get the staff much involved and knowledgeable about COVID. And because it was a novel coronavirus, it meant teaching ourselves as well as the staff to be able to approach and to provide the care that is necessary for them to be able to give the patients the best possible care with what we had available. We received support in training, and we had to provide training across the board to nurses as well as doctors and support personnel. And we pooled together to try and make the work that we do one that would be very productive and worthwhile. So we had to find ways of sharing up the staff, assigning and ensuring that we use them to the best of our ability. Of course, we had to get some support because opening this new unit and being able to staff it required additional human resources. And so we had to lean on the government to some degree, and we got the support from the Cuban Brigade. They brought in, after we've done our assessment, they brought in a set of nurses that have worked with us. We had to train them to some degree. We had to bring them in line with what we were supposed to do in the unit, and so we could work together to ensure that the patients receive the level of care that they deserve. So we've been working the COVID unit as a joint team. The nurses have put in endless hours of work, as well as all other medical personnel, because we do also have the support staff that joins together, and as a team, they work to provide the best possible care for the patients that come to KHMH who are in critical conditions or require a certain level of care here. So I must say that the staff has been very supportive, the nurses and everyone, to ensure that we rise to the challenge of overcoming and caring for the patients with COVID.
Ms. Charlene, just to be clear, so is it that you all have an assigned group of nurses to the COVID unit, or is all the nurses on rotation, or you've specialized and say, okay, this amount of nurses will deal only with that unit? How has that decision been?
Okay, what we did was we tried our best to train all level of nurses.
Okay.
Try to make sure that they're equipped, because we don't want to overburden or pressure any one set of nurses.
Okay.
So the training was across the board, and we rotate them, all staff, not only the nurses.
Okay.
But those persons who go in there, we rotate them, we test them at the end of their rotation period before they are allowed to go back into the general population. Of course, we have those nurses and personnel who have rose to the challenge and are willing to go back into the department to provide the care for the patients, because we do so by providing them with the necessary PPEs, and we make sure that we do the necessary steps to ensure their safety at all times.
Well, it's interesting that we are celebrating 25 years of KHMH during this pandemic. I mean, 2020 is a very unusual year.
Yep.
We'll never forget it. Some people have done all kind of memes and say the last thing they want to hear now is 2020.
Right.
But having said that, I remember, Michelle, that I was one of the few people fortunate to go visit your unit as you were preparing it before we declared any state of emergency. And it really was a modest unit, but it was an area you all tried to set up on the go, you know, because this was something that just suddenly came about. So I would like to know, from your perspective, how have you all seen that area perform? I know you've had deliveries already, because I remember when you even showed us the section that would have the delivery of for neonatal care, you know, and I'm thinking, who will come and deliver a baby with COVID? Like, it was far-fetched in a way in my mind, but clearly it's not in practice. So how has that unit been performing, and where do you see any further need for expansion or any improvements you would want to call upon donors to help with, or the government to assist with, fill us in on that, because that's really, COVID has taken over our lives.
Really, it has. And indeed, since your visit, we actually did some additional work on the unit and we expanded it a little further. And so at that time, we had space for 5 mechanical ventilators. Now we can say we are able to provide 9 ventilated service to 9 ventilated patients in that area. We've been able to address the issues with the doors and with other safety features, you know, the donning area, the doffing area for PPEs. We've been able to you know, strengthen the responsiveness of the area. And I think what was good for us is that first, what I think Belizeans say, the first wave that happened in March, I think we're just in the first wave now, but that first wave where we had the first 3 patients being admitted in the area gave us an opportunity, as we did our debriefing meeting with the staff, to be able to identify the strengths and weaknesses of the area, and we were able to improve on the area. And now I believe that we are better suited for the cases that come our way. We are managing up to 5, 6. I think the majority, we had 5 ventilated patients at one time in the unit. The performance has been spectacular. The team have been so dedicated. I mean, it's, you know, it's amazing to see how staff could come together and they form a bond, right? The COVID team, we call them, because they formed their own bond. And when it was time to identify the staff for the second round, they were just ready and willing to go. We have more equipment. The ministry have supported us with additional medical critical care equipment. And so I believe we are at a good position in terms of strengthening the area, because it certainly does seem as it will be for the long haul. I think we would need to strengthen the medical gas supply in the area to be able to, because what we did initially was a temporary expansion of our medical gas service to the area, but I think it would be an area where clearly we would need to develop more and to be able to have that area as a place, as a space that we could identify for isolation of critical care patients. COVID and other isolation cases that may come our way in the future.
And, you know, I just, you know, both in relation to COVID and I suppose in a general, in terms of the general thing, I think that one of the things that we, or that we can't ignore, I suppose, is that also the hospital has at times also received criticism in terms of both the services as well as the facilities for a variety of different reasons. And I just wanted to hear some perspective, and either Michelle or Dr. Thompson can take this, about how you would respond, I suppose, to some of the criticism that the hospital does receive, you know, both in the public and, you know, in several different forums. So what would you say, or, you know, how do you respond?
Well, I know that there are some criticism, and I think what the public needs to understand, we welcome criticisms, by the way. We actually have a complaint mechanisms in place. But I think what the public needs to understand is that Karl Heusner is the largest hospital in Belize, and it provides service to over, for the entire country. Mm-hmm. And so our occupancy is always very high. We maintain 85, 90% occupancy most of the time, right? So yes, there will be situations when the staff members might not be able to respond in the way that they know how to respond, and that in the way that the clients would want them to respond because of the volume. And that really is an area that we've been grappling with. We understand the dynamics, we understand the demand from our clients, and we also understand the issues that the staff are faced with. Because honestly, there is a lot for them to do at any given time. And everybody knows that Karl Heusner is understaffed. Even though we have 692 employees, we're still understaffed, particularly in the area for inpatient management. And so we accept the criticisms, we use the criticisms as opportunities to strengthen the service that we provide. And we work with our staff in terms of trying to get them to better respond to the needs of the public, of the clients. And I think they've been responsive. I think sometimes we fail to realize that it's a lot that they have to do, and there's a lot, they need a lot of persons that they need to respond to at any given time, but it's work in progress. And we strive to improve and to make it better for the population that we serve.
Indeed, you all, 25 years after, have come a long way. I mean, I'm old enough to know that we've come a long way, but the population has increased.
Yep.
So the pressure from the population on the services has dramatically increased. If we had KHMH when, at the time we had the old hospital and what the demand was, it would have been excellent. But every time we improved, the population increased, and who would have thought COVID would have come along?
Yep.
And one of my concerns is, as you celebrate, we know KHMH, the building, the hospital, is just that, the building and the hospital. You all have staff, nurses, doctors, and administrative and support staff. And one of my concerns as we go into this celebration is that in a while we'll be talking about the World Patient Safety Day. But I'm always concerned that health workers give so much, or people in the health sector give so much. They actually put themselves on the line for others, and you have to be mentally prepared every day to go deal with that. So I want to know, do you all have any special program or support program to help your staff? You know, because the building is one thing, but how good your personnel are prepared to cope with the changing times. Please, is there anything you have in place or hope to have in place to give them the support they need mentally and emotionally to deal with the stresses of the type of jobs you have?
Yeah. We do have safety programs in place, our infection control program, our quality assurance program, and we also provide not on-site, but psychological support through the Ministry of Health. We've recently trained 2 of our senior nurses in psychiatric nursing, and so they are also able to assist on the ground with staff members who may need counseling or who may need that special, psychological support. And so we recognize the challenge. We recognize that there are so much more that we can do, but we continue to put the programs in place to be able to provide for the safety and the mental well-being of our staff. I must say, and I think KHMH to date, we have not had one single patient, despite the many COVID and other cases of communicable disease that comes to our facility. We have not had any staff member that actually contracted COVID from patients that they've served. And so that is something that speaks volume, because it shows that safety for us, for our staff, is foremost. We stress the importance of our staff using the right personal protective equipment, that they maintain the safety measures that we've put in place, and we monitor that. And at the same time, when we identify that there are issues, with their mental well-being, we address that as well. And so, yes, it's World Safety Day, and I must say that safety, particularly now in this COVID pandemic, is foremost in the management of the care that we provide. So,
I'm glad you offered that information because I was going to ask that, especially because the last statistics I had seen showed that 11 doctors had become infected and 10 nurses, and I think it was 4 pharmacists. But there was a list that they were trying to show that in the health sector, we had at least, or frontline workers, at least 43 people who had become infected. And I mean, you never know how it would happen. COVID does not discriminate. But it's good to know that that has not been your case there yet, despite KHMH having the volume of it.
Right,
And we're sorry that COVID has taken over
I know.
so much about the celebration, but honestly, I mean, it's what people want to know, and the reality we have to deal with. But I have another question. You all delivered a baby there, and the mother was COVID positive. How did that operate? How did you all do the separation after? Or what did you do? I don't know. I was curious to find out how a COVID patient that needs to give birth is treated. So give us a little idea, please.
Okay, so far what we have seen is that most of our cases that have delivered were by C-section birth.
Okay.
Of course, we had the normal vaginal deliveries that were done, and of course, we have our midwives that are trained and have gone through the different trainings to equip them to provide the delivery in a safe manner.
Okay.
And so there's a section within our COVID isolation area that's equipped, and we have the midwives along with the team that goes in and does the delivery under very safe measures. As part of the protocol for the maternal and child health, what we do is separate. Once the mother is positive, the protocol dictates that we separate the baby from the mom. Okay. Unfortunately, it's not a normal situation because we would usually encourage bonding with the mother immediately after birth. But unfortunately, due to this COVID situation, it's a little bit different. And so we have, as you had indicated before, we have an area within the COVID isolation area that we set up that we would put the baby a little bit different and provide care to the baby, and the mother stays in her area and we care for the mom. And at the point of discharge, once we're clear that the baby is safe and the baby has not contracted, then that baby goes with a family member or some person identified to care for the baby separately until mom is clear. So we do have the protocols in place, and we try our very best to ensure, along with the support we get from ministry and families and of course the staff, to provide the safest care for mother and child.
All right.
Oh, yes. Thanks
good.
for explaining that. I was wondering how it's done.
Yeah. And unfortunately, we are just about out of time. But perhaps, Michelle, you can leave our viewers with perhaps any final message that you want to give, and maybe talk a little bit about what are your hopes for the future of the hospital.
For the next 25 years.
Well, clearly we have a vision for the next 25 years, and we want to continue to strive for excellence. We want to be able to put the standards in place in all the service areas. We've worked on those, and we want to continue to do that. We want to be able to continue to work along with our clients to help them to be a part of the service that they receive, the care that they receive. We want to make sure that they are always first, the center of the care we provide, because without them, KHMH would not have existed. I want to say that for our staff, we want to continue to build their skill sets and to build capacity in the staff, because I mean, our staff is our main resource. I mean, without them, none of what we've accomplished would have been possible. And moving forward, we just want to recognize our staff and to say thank you, and to encourage them to continue to commit to what they do and to take pride in what they do, because they do it well. So that's all my parting message for the public. Work with us. We're here to serve you. Thank you.
Well, we thank you all. Keep on doing the good work. I mean, despite all the criticism, we know nothing is perfect, but we really thank you all for the services you've been providing. I know that when it comes to the professionals, you all want to do your best. The little politics aside, that has nothing to do with how I really think we have great professionals there. I've heard really good stories of good service as well. So all the best as we celebrate 25 years, and we pray that you all stay safe, keep on providing services to all of us, and do enjoy your day, and we look forward to hear good news another 25 years. Gavin will still be around then.
Oh, yeah. Ladies, thank you so much for joining us. With that, we are going to be taking a break. And when we come back, we are going to be talking all about World Patient Safety Day and COVID-19. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.